The Health Ministry is looking to refresh claim limits of its national insurance scheme, MediShield Life, to ensure that as many as 9 in 10 bills will be subsidised. It will also explore expanding coverage to more outpatient and novel treatments to keep them affordable. MOH says that premiums will inevitably rise due to these measures, but it will ensure premiums can be paid fully by MediSave as far as possible. Sabrina Ng with more.
Rising demand amid a rapidly aging population and global inflation. These are some of the forces pushing up healthcare costs in Singapore.
The size of hospital bills are getting larger and larger. Bill sizes have grown by 5% annually in public hospitals and by 7% annually in private hospitals over the last few years. Subsidized patients are seeing hospital bills that are unexpectedly large. And after subsidy, after MediShield Life, there is still a substantial out-of-pocket component left. This is when higher healthcare costs really start to bite.
It's why the Health Ministry has tasked the MediShield Life Council to review the national insurance scheme. Some changes it will look at include increasing claim limits for surgery and hospital stays to reduce out-of-pocket costs. The Council will also consider enhancing coverage of outpatient treatments already covered, like dialysis. Coverage could also be expanded to novel treatments like cell, tissue and gene therapy products. Such treatments could help cancer patients, but are very costly. One healthcare financing expert says the government needs to assess how reliable these treatments are before covering them under national insurance.
Only when it is cost effective. That means you're not paying exorbitantly, but it is a fair price and is shown to be effective. Then you should use public funds to finance it. Before you decide to fund it from insurance, you must set up the limits and the criteria first. In other words, one of the criteria is you have to decide how much, for example, 5% of your expenditure is going to be limited to this category of drugs.
Health Minister Ong says these changes will better protect Singaporeans against major health episodes, but will inevitably push up premiums. The last MediShield Life review saw premiums increase by about 25% on average, with higher increases for seniors. But Mr. Ong stresses that no one will lose national insurance coverage because they can't afford the premiums.
We will consider enhancing premium subsidies or have MediSave top-ups for specific groups. We may have to use more MediSave for small hospital bills so that MediShield Life can better focus on big hospital bills, and that way we moderate premium increases.
Recommendations from the Council will be finalised later this year.